Spinal cord trauma. Spinal cord trauma refers to any injury to the spinal cord that results in temporary or permanent changes in its function. The spinal cord is a vital part of the central nervous system, transmitting signals between the brain and the rest of the body. Spinal cord injuries, SCI, can lead to devastating physical, psychological, and social consequences, including paralysis, loss of sensation, and impaired organ function. Causes of spinal cord trauma. 1. Traumatic causes. Motor vehicle accidents, most common cause. Falls, particularly in older adults. Sports injuries, such as diving or high-impact collisions. Violence, such as gunshot wounds or stabbings. 2. Non-traumatic causes. Tumors pressing on the spinal cord. Infections like tuberculosis or abscesses. Degenerative diseases, such as herniated discs or spinal stenosis. Types of spinal cord injury. 1. Complete SCI. Total loss of motor and sensory function below the level of the injury. 2. Incomplete SCI. Partial preservation of sensory or motor function below the injury. Common syndromes. Anterior cord syndrome. Loss of motor function and pain temperature sensation. Preservation of touch and proprioception. Central cord syndrome. Weakness in the upper limbs more than lower limbs. Variable sensory loss. Brown-Séquard syndrome, loss of motor function and vibration proprioception on one side, pain and temperature loss on the opposite side. Clinical manifestations. 1. Immediate symptoms. Paralysis, tetraplegia or paraplegia. Loss of sensation. Breathing difficulties. Injuries above C4. Loss of bowel and bladder control. 2. Complications. Neurogenic shock. Hypotension and bradycardia due to autonomic dysfunction. Spasticity and muscle atrophy. Pressure ulcers and infections, deep vein thrombosis, DVT, and pulmonary embolism. Chronic pain. Diagnosis. 1. History and physical examination. Mechanism of injury. Assessment of motor and sensory function using the American Spinal Injury Association A impairment scale. 2. Imaging studies. X-rays. Detect fractures or dislocations. CT scan. Detailed view of bone injuries. MRI. Evaluates spinal cord, soft tissues, and potential compression. Management of spinal cord trauma, emergency management. 1. Spinal immobilization. Use a cervical collar and spinal board to prevent further injury. Avoid unnecessary movement during transportation. 2. Airway and breathing. Secure the airway, particularly in high cervical injuries. Provide mechanical ventilation if required. 3. Circulation. Treat hypotension with fluids and vasopressors. Monitor for signs of neurogenic shock. 4. Pharmacological management. Methylprednisolone, controversial, may reduce inflammation if administered within 8 hours of injury. Definitive management. 1. Surgical interventions. Decompression to relieve pressure on the spinal cord. Stabilization with rods, screws, or fusion for spinal alignment. 2. Rehabilitation. Physical therapy. Maintains muscle strength and improves mobility. Occupational therapy. Enhances independence in daily activities. Psychological support. Addresses emotional challenges like depression or anxiety. 3. Long-term medical management. Spasticity management. Baclofen, botulinum toxin injections. Bladder and bowel care. Catheterization, bowel programs. Pain management. Neuropathic pain medications. Gabapentin, pregabalin. Prognosis. Recovery depends on the severity of the injury and timely intervention. Incomplete SCIs have a better prognosis compared to complete injuries. Advances in regenerative medicine, such as stem cell therapy and neuroprosthetics, hold promise for improved outcomes. Prevention. 1. Use of protective gear, helmets, seatbelts. 2. Fall prevention strategies for older adults. 3. Promoting safety in sports activities. 4. Early diagnosis and management of degenerative spinal conditions.